Biologically speaking, I mean, they've done studies. If you just put like a more symmetric face or more beautiful face in front of chickens, they'll peck at those images more than like an unsymmetrical situation. To optimize symmetry, you're kind of chasing your tail, especially when it comes to fillers and these things that can change the shape of the face. It's very hard to get a three-dimensional structure like the face exactly symmetric, and you can go down a very weird path chasing that perfect symmetry.
Dr. Michael Bassiri-Tehrani is a double board certified facial plastic surgeon and otolaryngologist who focuses exclusively on the face, head, and neck across both cosmetic and reconstructive work. He's certified by the American Board of Otolaryngology and Head and Neck Surgery and the American Board of Facial Plastic and Reconstructive Surgery. He trained through an accelerated BS MD program at CCNY and Stony Brook, completed his residency at the New York Eye and Ear Infirmary of Mount Sinai, and did his fellowship at USC and the Lasky Clinic in Beverly Hills. He is clinical assistant faculty at Albert Einstein College of Medicine and serves as the treasurer and president-elect of the New York Facial Plastic Surgery Society. From his Upper East Side practice, his work spans rhinoplasty, facelifts, and blepharoplasty alongside non-surgical rejuvenation with a philosophy centered on natural, undetectable results. He's also become a go-to media voice on aesthetics, quoted on everything from celebrity tweakments to why some patients build resistance to Botox. Welcome to our podcast today.
Thank you for having me. Great introduction.
Okay, so Mike, let's start with the easy questions.
Sure.
Why are men suddenly interested in skincare?
Everyone right now is interested in looking better, men and women, and I think a lot of it has to do with the prevalence of cameras and social media and just being on video practically all of the time. So any little things that people can do to look better, people want to do it. And it's not just men, it's definitely women as well. But traditionally, men were maybe a little more hesitant to doing things for their appearance. And now that taboo has kind of gone down a bit.
That's great. So you're seeing a small influx of male patients into your clinic soon?
Yes, definitely.
Oh, and what procedures do they come for? What are they actually asking about?
That's a great question. So I focus on facial plastic surgery. So a lot of my practice is based on surgical rejuvenation, so rhinoplasty, facelift, endoscopic mid-face lifting, also chin implants and augmentations, just things to make the face maybe look more masculine. And that's on the surgical side. On the less invasive side, we're seeing more of things that are preventative for skincare, so platelet-rich fibrin injections, microneedling, some Botox and fillers, which have always been there, but also continuing.
And what age groups are these patients?
It spans from 20s and up.
And what are the chief complaints? Are they worried about looking older, fatter? What is the range that you're saying?
Well, weight isn't so much of an issue in my practice because, again, I'm focusing on the face, so head and neck up. And it really depends on the age group that's coming in. So I think that the younger age groups, they don't really need like rejuvenation. So it's going to be more about transforming some of their appearance as opposed to restoring it. Mm-hmm. So people who are younger may want to do procedures that are going to make them look more masculine, such as like a chin implant or chin filler, mm-hmm. and or a rhinoplasty. Whereas as you get older, you're thinking of, okay, how do I preserve the way my skin looks or my face looks? Or if you get a little older than that, how do I turn back the clock on maybe some aging in the face and neck and make me look more vibrant again?
That's such a great answer. So I want to dig a little bit deeper into this phrase that you use repeatedly. What do you mean by more masculine? What does masculine look like versus feminine?
Well, it's a great question, and it really all depends on what your perception is of masculine and feminine and what you want yourself. Some of the patients that I'm seeing, they just want a stronger jawline with a more pronounced chin, and they don't want some of the more rounder features that can come along with fillers that are placed in with females. So women would sometimes want a rounder, fuller cheek. Men don't necessarily want that. We want more stronger, pronounced bony structures. And that's what I'm seeing a little bit more of.
I see, more angular, less bulbous.
Yeah, I think in general, like a softer cheek with a more tapered lower face is going to be traditionally what women are requesting, and men are going to want a more angular, sharper jawline, and things that will kind of signal vitality and strength.
And there's a huge difference between how someone can approach plastic surgery, right? So I see, I'm sorry, I'm going to say a few names now. I see the latest with Brad Pitt, for example. His lift or whatever he did looks amazing. How do I become a Brad Pitt, or how does one become a Brad Pitt?
I mean, look, I don't know if he even did anything or what, and I really don't love commenting on maybe some of the celebrity stuff. It's many celebrities are celebrities because they're naturally very beautiful and engaging, and there's a whole personality that goes along with it. And that adds to kind of the presence of these people walking in, and you can tell when these people walk in and the way they engage the room. So as far as what he's done, I don't know. He looks incredible, and it's probably just small things over time that don't make him look too different. A big problem that a celebrity or a known figure can run into is looking too different, too fast, and their face is their whole brand, and it's a problem if they look radically different. And I think that philosophy is now pouring over into just general society. I think a lot of people are now kind of the heroes of their own story on social media, and having themselves look completely different or too different, too fast can actually damage their brand, and they don't want it. So people are actually looking for more subtle changes, in my opinion, especially in the last maybe 4 to 5 years. And ironically, they're more open about what they've been doing as well. A lot of my patients have been more open about what they're doing, but they also don't want to look that different. So it's kind of different than maybe 10, 20 years ago, where people would do more aggressive changes, but also want to hide them. And so I think there's just this generation of transparency with everything that you're doing. I mean, you can't really hide from videos and social media anymore. So people are just owning up to what they're doing, but they don't want to do big changes.
I love that. I think we need more honesty all around, because, you just don't wake up one day and start to look different, and then people have to just nod their heads and accept it. So I really do like it.
Yeah.
So let me double down on that, right? So when do I start making these small changes? And I'm assuming you're talking about things like filler and Botox.
I think that a lot of it is also prevention and lifestyle. The reason people look good when they're 50 is because they had a very good lifestyle and started eating right, exercising, preventing sun damage with sunscreen, all of that way early. And those are just normal common sense medical advice that you can give anybody. When you're starting to talk about interventions and cosmetic, even if it's non-surgical interventions, usually 30s, but even mid to early 20s in some people.
Okay.
And so you might not need to do as much. The frequency in which someone does Botox may not be as often as someone who's a little bit older and some of the lines and dynamic wrinkles are setting in. But you kind of want to break up some of the patterns of movements or muscle contraction in the face so that you're not getting one crease across the same place. And again, it's different for men and women. I think women generally don't want any kind of wrinkles or anything, but in men you have to ride the fine line of making it a masculine, tasteful change with retaining with character and some imperfections. I mean, you can't look porcelain skin smooth. I think that would look very odd, and then people will have questions.
Actually, that's true. So I remember when I was much younger, I read about the symmetry and how symmetry indicates beauty. Do you still agree with that statement?
So that's yes, in a way. I think that no one's face is symmetric, and you take any beautiful person's face or classically considered beautiful face. There are points of asymmetry, and sometimes depending where that asymmetry is located, whether it's more medial on the face, maybe it's a distinguishing freckle or something closer to the center, that can actually affect things. But biologically speaking, I mean, they've done studies. If you just put a more symmetric face or more beautiful face in front of chickens, they'll peck at those images more than like an unsymmetrical situation. But that's not the end all be all. I think that to optimize symmetry, you're kind of chasing your tail, especially when it comes to fillers and these things that can change the shape of the face. It's very hard to get a three-dimensional structure like the face exactly symmetric, and you can go down a very weird path chasing that perfect symmetry.
Right. And, I do want to take a step back, right? So you know all about the face. Can we actually break it down, like, in order of the features? So let's start with, I don't know, my forehead first. Is there such a thing called a big forehead and a small forehead?
Yes and no. It really all depends on the person. There are like these standardized guidelines that are in every textbook of plastic surgery of what's an optimal beauty standard. And it's really kind of just based on classical art and mathematical equations, which if you optimize everyone's face to the perfect mathematics, it would not look right. I mean, you take pictures of celebrities and you try to morph their face to fit like the golden ratio of everything where it's supposed to be. They look weird, they look different, and they don't look as good as they do.
Yeah.
It's the natural variations in everyone's face that gives them character, gives them personality, and frankly makes it interesting to look at. And if we're talking about, okay, how do we approach, there's like so many different things in the face that you can look at and address. I think that it goes by age group. So what age you are and your goals are you trying to transform or restore? And then I like to break it down just to kind of make sense and organize it in my head. Facial thirds, so upper face, middle third, lower third, and there's different procedures and different sequences in what you would do. And then depth, there's the outer layer of the skin, then there's maybe some deeper set wrinkles, and then finally folds, which would be like extra loose skin that may be best treated with something like surgery. So you have to kind of distinguish what it is that's bothering people. And the face also ages kind of in general with a specific sequence. Starting with our 30s, we start noticing that our eyelids get a little maybe puffier.
Yeah.
There's a little bag that starts falling down. And then as we get into our late 30s or 40s, the cheek kind of descends, and then you get this, and you get a little bit more of a drawn out look. And then finally, the lower face jowl, and then the neck. And this sequence dictates what we want to do surgically. There's only so much surgery you could do at once, just from a safety perspective, and also from a just logical perspective of looking too different. So do you stage these procedures? Do we do maybe the procedures that have fewer scars first? And do we limit them, and do we address them as they come up? Or do we wait till things get kind of worse? And that's really a personal preference. Some people like to wait till things are very loose and then just kind of address it all at once. Or again, if you're more forward facing and public facing, do you do smaller things over time? So personal preference really, really matters.
So staying with your top third, right? So let me talk about the under eye situation. So a lot of men that wrote in have talked about the fact that they are in front of a computer all day long.
Yeah.
And so a lot of them have dark circles or under eye bags. Do you recommend that they actually see a plastic surgeon if they can't correct it, say topically, like under eye cream only does so much? But do you recommend that they look into a filler or maybe a blepharoplasty or anything like that?
I think yes, especially with the under eyes, because the under eyes are an incredibly complex, annoying problem at times because you're dealing with multiple things. You have the actual fat that's located in the eye socket that over time starts bulging out because what's kind of holding it in place gets weaker. And that also has to do with the bone structure over here. So if that bone is not well projected or supporting the eyelid as a shelf, then that might be a little bit more pronounced. So if you go to, let's say, a dermatologist or an injector or someone who may not be familiar with the surgical options for that, then they may want to try all sorts of non-invasive things and exhaust all of that. Where if you go and at least have a consultation with a plastic surgeon beforehand, facial plastic, oculoplastic, any of these doctors, and get the information of what may actually be going on, they may have some more tools in their tool belt that can help the specific problem. Under eye circles and darkness under the eyes could be from allergies causing the you're visualizing the venous blood under the thin skin. It could be pigment issues. So darker skin patients may have much more pigment accumulating under the eyes, and in that case, okay, what do we do to treat that? Or you could actually have hollows and then it's a shadow that's forming. So which one of these is exactly the problem? And sometimes it's multiple, and sometimes you need to address it in multiple ways at once, or spaced out over time. But getting the information from multiple sources and kind of distinguishing what fits your values and what you actually want to do, and then making a decision with what feels right, I think it makes the most sense.
So let's talk about the mid third of your face, right? So
Okay.
let's say the nose is hooked, or it's too bulbous, or they're like it just doesn't suit the face, or as you get older, I know that people's noses become bigger. What are some of the things that you would recommend? I know you went viral recently for a
We're doing
non-invasive surgery.
I think the nose is interesting. It's almost like it has to be its own topic altogether, because it's really the cornerstone of the face, and it can be either like distracting, or it just at best melts into the background of the face and no one pays attention to it. And that's a good nose, is the ones that you can't really pay attention to. The nose technically doesn't get really big. It's not like it's growing the way people think.
Oh, it's not.
What happens is, as you get older, and certainly with pregnancy or age, the skin can get a little bit thicker. As we get older, the cartilage support gets weaker in certain areas, so the tip loses support. The connections over here allow the tip to get droopy. So what happens is, as the tip drops down, the nose looks longer from certain angles from the front view. From the side, it can look hooked or droopy, or pull down when people smile. That's a big one that I'm seeing right now, and I think it definitely has to do with not just social media, but now how prevalent videos on social media are going. So when people smile, they're actually seeing their tip plunge a little bit, as it normally would, and they don't like it. And so there's all different kinds of rhinoplasty surgery that could be done to change the shape of the nose. And it can range from open rhinoplasty, treating, again, the bottom, middle, or upper third. It could be closed, open. There are some things that can be done awake as well. I do a procedure where I support the tip of the nose in very, very specific patients through a minimally invasive, I call it a tip stitch rhinoplasty, just to give it maybe a little bit of support that it's lost or may have never been there. And I think that's helped a lot of people. The other traditionally discussed areas of the mid-face are going to be the cheeks. So if a patient doesn't have strong cheek support in their bones, this fat pad can kind of come down, and people will look a little drawn out, and it kind of gets the lower lid as well. And sometimes that can be improved with volume, so fat injection or nano fat or fillers. Other possibilities would be a mid-facelift, where we're actually lifting the cheek up. And I do that endoscopically through a small incision in the scalp that doesn't get seen, and could lift the brow and the cheek up. And I think that's kind of the future of where a lot of rejuvenation is going, just less invasive, smaller things.
Great. And I've noticed that there is this whole phenomenon with buccal fat removal for women.
Yeah.
Is there such a thing for men as well?
Men have buccal fat pads, definitely. I think the buccal fat trend went up and kind of has come back down, and I think it was overdone for a while. These buccal fat pads are located in the cheek. They're a little bit smaller, depending on how round your face is. It could be the size of a golf ball or smaller. And I think it's one way to slim out the cheek, and it works well if someone just always had a very round face from childhood, and they want to slim out the lower part of their face, and it pairs very nicely with other kind of jawline enhancing procedures. The problem with it is, when you take that fat out, if patient's already very slender, you can overdo it and they can look very gaunt, and it makes people look way older sometimes. And you don't really tell right away because they're swelling. But as they age, and I have some patients who had it done who may have not needed it done. They were pressured into it by other doctors, and they just now come in, and we sometimes put volume back into the cheeks to make it more soft.
Oh, interesting. And so I think there are people who are interested, but you have to be careful because of the fat. Okay.
So I think it's now gotten kind of more of like a bad rep, but in the right person, it's a very good option, and you won't get that extra slimming or gaunt effect until you're like 80 if you have like a very full face to begin with. The problem is taking it out in already very slender patients.
Can I ask you a question? So can they go to the gym and also work out and get a chiseled face? Is that possible?
Not for the buccal fat because it's not hormone sensitive fat. It's a separate fat pad. Actually, it's very smooth. It's very beautiful fat pad actually. But other parts of the face, in order to see changes as far as weight loss, you have to lose about 25 pounds or so before you start noticing the actual face change. So it's like one of the last things that you lose fat in.
I saw something on a Looksmaxxing video that they can eat like mastic gum and they can chew on it and get a chiseled jaw. Is that true?
Possibly. I think you do have very strong muscles here called the masseter muscles, which are responsible for chewing. And yes, if a patient has very, very strong masseter muscle, then you'll have more of a square, stronger jawline. And in women who have that and don't want it, and they have a strong muscle, we actually inject Botox to weaken the muscle, and that slims out the jawline.
Right.
As far as the opposite, I'm sure it's like also possible. How much you have to chew and what you have to do to get there, I don't know.
Yeah.
But also keep in mind, it's a very powerful muscle, and people are grinding their teeth and having tension headaches and other issues. So we do inject Botox for that muscle just as a medical thing to help people with pain. So if you're just like any muscle, overdeveloping it and overworking it and it starts tensing up on you, then you could have like TMJ pain and headaches, and it might not actually be worth it.
So let's go to the last part of the face, which is, let's say, focus on the chin and maybe even like the neck.
Yeah.
What can we do there?
So for the chin, it's actually one of my favorite areas to inject filler because it's a very immediate and substantial kind of change in someone who doesn't have a strong chin. You put this hyaluronic acid, typically, it could be something else as well, to just kind of push the chin forward. And what that does is it creates the illusion of a longer jawline, and it slims out the jaw. And this is actually both men and women do very well with this. And what's nice about the fillers is you can dissolve it. So if you use hyaluronic acid and you don't like it, you can melt it away and you're back to where you were. If you love it, you can put an implant in, you can melt it away and put an implant. It typically lasts anywhere from 6 months to a year. The result gradually fades out. So some people come in around then to touch it up again. Yeah. As far as the neck, it's very interesting because some patients just never really had a sharp neckline. So you have to distinguish that from maybe someone who's aging and has loose skin as well. And if there's a lot of fat and you can pinch it, and the superficial fat you can actually pinch, and you can tell if there's a lot of thickness there, that's something that submental liposuction can help, and that could be done either awake or under some sedation. And you get some refinement of the jawline, but not complete necessarily, because there's another layer of muscle and like a paper thin layer, and then a deeper fat pad in there. So the structure and the deeper structures of the neck have a big part to play in it. Mm-hmm. And sometimes you have to go in and kind of debulk some of that. So patients who just always had a lot of fullness over here, just removing the fat alone isn't necessarily going to do it. And if you're not young to the point of, if the skin doesn't have its elasticity, then you can remove a lot of fat under there, and you may even go in and take the bigger structures out of the way, but then you're left with loose skin, and then what do you do? And that's the point where you do something like a neck lift, where you remove the excess skin from behind the ears.
And what's interesting to me is that people are interested in these surgeries now because it's more commonplace knowledge, right? And people are getting into it. But I do know that Ozempic has become an epidemic, right? And I don't want to call it an epidemic.
It's actually, it's a good method. It does what it's supposed to do, and it helps a lot of people.
Right.
So I wouldn't call it like bad.
It's not bad, but is Ozempic face a thing with men as well?
I think so, yeah. I've seen patients, both men and women, and what it really is I mean, it's not the newest thing. It's people who have drastic weight loss. And we've seen that before. There's maybe an added element of maybe because they're not eating as well or as much, you're maybe missing some of the nutrients that go to the skin. But the overall effect is there's a lot of loose skin fast, and people look a bit more aged fast, and you have to treat the skin. So these patients may be losing like that 25 pounds plus that we talked about, where all of a sudden the face does look drawn out and slenderized, but there's all this extra skin that needs to be kind of redraped. And so that is something that we're seeing for sure.
So let's move away a little bit from the face and let's go a little north up. So what about hair? I know hair is a very emotional topic for men.
For men especially, this is one of the things that everyone sees, and it's hard when people lose their hair. The men that do the best with hair loss are the ones who had it, I think, when they were younger, like in their 20s. They kind of adjust very quickly to having some hair loss issues. But there are a lot of treatments out for it now. And topically, people are using minoxidil to enhance blood flow to the hair, and that thickens existing hair. PRP injections thicken existing hair. And then there's more like hormone-based medications that will prevent further hair loss, but they have some side effects, and not everyone wants to take them. Hair transplants become more and more common and just better executed with nicer results. And it used to be that you have to take a big strip of hair from the back, and now the hair follicles with follicular unit extraction, the hair follicles can be removed one by one and implanted one by one. So you don't have like a incision in the back, and you can wear your hair shorter as a man without like a noticeable scar.
And so the recovery times are much smaller then?
The recovery times, I would say, are comparable because you still have the swelling of the implant sites, but the actual donor site scarring is much better, I think. And the way the hair follicles are placed are looking more and more natural. And the planning of it is better. And then you're teaming it up with things like PRP that are going to enhance how many of those follicles are taking. And so you're getting a more natural result overall.
So, doctor, can I ask you what PRP is? I've heard the term so many times, but I don't quite understand it.
Yeah, it's called platelet-rich plasma, which basically your blood gets drawn and spun in a centrifuge, and the top layer contains your plasma layer, and then there's a layer within that which has a concentration of platelets, which are kind of what causes blood clots in the body, but they have also growth factors and signals that are meant to attract healing factors to that area. And so there are a lot of studies that are showing that you inject that in and around the hair follicles, and it's kind of giving the nutrients and signaling of like, hey, like, thicken this area and bring some growth factors here.
Got it. So I wanted to take a step back to, what can we do before I come to you, right? So are there any topicals that you would recommend for skincare, for example, that, hey, Deepika, start here first and then we can talk in a few years?
Yeah, I think the big three, well, actually, even before that, I would say before topical stuff, just a good healthy diet, I think is just super important. And then certain supplements. I mean, just a good multivitamin, but omega-3, like fish oil, it has so many great effects on the hair and skin. And this isn't a controversial topic. I mean, it's literally added to dog food. So for a healthy coat and shine, I mean, if you're putting it for your dog, why can't we just have good healthy fats in our diet, even if you don't want to take the supplements? But I think that's going to be working from the inside out. And typically you'll get a lot of nice results with just keeping your body healthy, and it's a reflection on the outside. Now, topically, the big easy ones are going to be some form of retinol, vitamin C topically, and then sunblock to just prevent any damage. And the reason they're all important is retinol is going to stimulate your skin cells to turn over a little bit quicker. So every 30 to 90 days, your skin is kind of growing from the bottom and sloughing off on the top. And the top layer is just really not even alive. It's just keratin that's there protecting you. And if you create the turnover faster, you just get healthier, more thicker skin from the retinol use. It does make you sun sensitive a little bit. So a good sunblock is going to be very, very important to combine with that. And that is actually, people don't know it, the sun is going to inhibit it's going to destroy collagen and elastin, but it also inhibits your immune cells in your skin, which are responsible for counteracting aberrant cells, so cancer cells. So actually you're limiting your body's way of getting rid of cancer cells. So that's why UV radiation is actually dangerous for skin cancer, and people don't know that. So a good sunblock is just going to be good for your health and skin health overall. And then vitamin C has been shown to reduce kind of just environmental damage to the skin and protect it against some free radical damage.
So why is it important, right, to take care of your skin? Can you talk a little bit about, forget the beauty and aesthetics aspect of it, just talk about the health of skin.
You're eliminating a lot of toxins out through your skin, you're sweating. It's the most visible reflection of your inner health in a way. And so there's just a lot of social signaling with having good skin and looking like you're a healthy person. So it's also one of those things where you have to be very consistent with it over time to see results. And I think especially for men who have thicker skin and may not see we might not see the error of our ways right away because we can compensate because our skin is thick and it has all this blood flow from the hair follicles. At some point, that like poor lifestyle is going to present itself. And so it's sometimes overlooked.
Yeah. And in Silicon Valley, in the finance world, men are working constantly indoors behind a computer and then going out and drinking. At least in New York, I know that there's a whole alcohol lifestyle.
It's more than California.
Yeah. How do you think that that impacts the way they look and the skin that they carry?
Well, alcohol itself is going to be very dehydrating to the skin. And again, it's just like, essentially it's a toxin that you're drinking that goes like throughout your whole body. And so that's obviously not good. But then you have all the other stuff that comes along with, having a few drinks and like, oh, maybe I'll, have some fries and other unhealthy, greasy stuff. And all of this kind of impacts your skin health. Just, you're making poor decisions over and over again, and it compounds over time.
Agreed. So I want to leave with the last question, which is, what do you use for your skincare?
I don't. That's like the hardest thing. It's interesting. I like personally, I use like a La Roche-Posay facial wash. I'm pretty simple. I like SkinCeuticals for me personally, like a vitamin C Floridin serum.
Yeah.
And then I've used all different kinds of sunblock, but like the simplest and easiest for me is like Neutrogena Sheer Zinc. I like the zinc oxide because it immediately reflects light, so you don't have to wait 30 minutes for it to activate. I also like Ulta MD, and this one's like easy enough for me to find, and I can just keep it everywhere. And those are the big ones for me. I've used some retinols in the past, and I'll do that at night sometimes. But again, I'm not like a dermatologist, so I don't have like a very elaborate thing. And I find that keeping it simple is going to be the easiest way for me to just keep doing it.
Great. Thank you again for being on our podcast.
Thank you for having me.